what will be the things that you will look for to give that fellow a feedback on if he has done or she has done a good job or could be better, or where were the weaknesses?
What I do is I tell the fellow, evaluate this as if you were the reviewer. What would you really do? It's not just a simple exercise. I want to see how you approach this. And we all have our own different ways of doing things. For my part, I will do my own review, and I will go through the strengths and the weaknesses of the paper, and then hopefully at the end of my review I will make suggestions. Here's what's needed. Maybe nothing is needed. Maybe this is perfect. This is fine just as sent in. That's rarely the case. But then when I sit down with the fellow who's reviewing this, I sit and listen and let them finish, and then ask them if there's anything more they want to add. And then I ask them, what did you really think about this? How would you rate this? Because we usually have a number scale. On a scale of 0 to 10, what parts of this are a 10, and what things would you like to get rid of? And then discuss why the fellow, he or she, is thinking the way they're thinking. So I want it to be an experience where I get the fellow to do his or her own work, and then I critique that and then go from there. And often I change what I'm going to do in my review, or often I may, depends on how senior the fellow is. The fellow may be able to write most of this, and I'll just make sure it's done correctly. But if it's sent to me, I'm responsible for it. And technically, there are limits on how many people you can show something to that's being submitted. The author who sends something in has a right to privacy. But I think in the training process, having one fellow work on it with you, you have to do that or you're not learning. It's like, who's operating on a patient? Is it the attending, or is it really the fellow or the resident? And the answer is yes. The answer is they're both doing it, but they're both responsible, but the senior person has got to be sure that things are done right.